Hello, my name is Professor Xiaohui Niu from the Department of Orthopedic Oncology Surgery at Beijing Tishuitan Hospital, and I'm joined by Professor Hans Golderblom from the Leiden University Medical Center. On behalf of our co-authors, it is our pleasure to present a summary of the manuscript titled Pimicotinib in TGCT, Results of the International Randomized Placebo-Controlled Phase 3 Maneuver Study. Tenosynovial giant cell tumor, or TGCT, is a rare locally aggressive soft tissue tumor that causes significant chronic pain, stiffness, and functional impairment. TGCT is driven by the overproduction of colony stimulator factor 1, or CSF1, which promotes tumor growth. Surgical treatment for TGCT is not suitable for all patients, and there is an unmet need for readily available, effective, and well-tolerated treatments.
Maneuver is an ongoing global multicenter randomized placebo-controlled double-blind phase 3 trial designed to evaluate the efficacy and safety of pimicotinib, an oral once-daily highly selective CSF1 receptor inhibitor in eligible patients with TGCT. 94 adult patients with histologically confirmed, unresectable, and symptomatic TGCT were enrolled across China, Europe, and North America. Patients were excluded if they had prior treatment with CSF1 or CSF1R inhibitors, multi-kinase inhibitors such as imatinib and nilotinib were allowed. Patients were randomized 2 to 1 to receive either pimicotinib 50 mg once daily or matching placebo for 24 weeks. The primary endpoint was the objective response rate at week 25, as assessed by a blinded independent review committee or BRC per RECIST version 1.1 criteria. Key secondary endpoints included BRC assessed objective response rate based on TGCT specific tumor volume score and mean change from baseline in range of motion of the affected joint, worse stiffness and worse pain, and patient-reported outcome measures, information on physical function scores. Maneuver met its primary endpoint with a significantly higher objective response rate for pimicotinib compared with placebo at week 25, 54 versus 3% respectively, as assessed by RECIST 1.1 criteria. Importantly, patients treated with pimicotinib showed clinically meaningful improvements across all clinical outcome assessments compared with those treated with placebo, with early, durable, and statistically significant improvements in range of motion, stiffness, pain, and physical function.
Most treatment-emergent adverse events in maneuver were mild, including most manageable asymptomatic laboratory abnormalities. Rates of dose reduction and dose discontinuation were low among patients treated with pimicotinib at 8% and 2% respectively. Clinical events reported in greater than 10% of patients include pruritus, facial edema, rash, perioperative edema, fatigue, nausea, and headache. Importantly, there was no evidence of cholestatic hypotoxicity, drug-induced liver injury, or hair or skin hypopigmentation, and no deaths during the trial. In conclusion, the primary analysis of phase 3 maneuver trial demonstrated that pimicotinib provides robust tumor reduction in patients with TGCT, along with clinical meaningful improvements in TGCT-related functional limitations and symptom burden with an acceptable safety profile, suggesting that pimicotinib may offer a safe and effective treatment option for people living with TGCT.